Good evening everyone. If I am audible and visible, please send a thumbs up in the chat box. Okay, so let's start. Now see the question number 1. A patient was taken into emergency room following road traffic accident. Upon investigation, he responded to pain by opening eyes. Clear? Using inappropriate words. Hello paracetamol, hello Rohan, hello Kostav car. हाँ प्रेप लैडर में अपडेट करेंगे. yes. Using inappropriate words, withdrawing his hand from the stimuli, calculate the GCS. Clear? So first see what is E, what is V, what is M. Eye opening was there to the painful stimuli. So this is E2. Then after that, verbal response, he was using inappropriate words. Inappropriate words means V3, and patient was having withdrawal to pain. So what? M4. So it is E2, V3, M4. Correct answer is option number C. Correct answer is option number C. Okay, now see the second question. You tell me Clonorchis sinensis is related to which type of cancer? And guys, if you want to add something in the language of question, you can do that. If you want to tell me something about the change in the options, please tell me. Clear? So if there is improvement required in the language of question, you tell me. If some options were not there, you also tell me. Okay. So what is the correct answer? Clonorchis sinensis. It is related to which type of cancer? Ankit Chavdi wants to say C. Atar Rahman wants to say B. Clear? You know that this Clonorchis sinensis and Opis torquis viverni, it's a risk factor for cholangiocarcinoma. What is the organism responsible for carcinoma bladder? This is Cystosoma hematobium. It is Cystosoma. This is Cystosoma hematobium. Hematobium. Clear? So what is the correct answer here? The correct answer is option number B, that is cholangiocarcinoma. Okay. Now tell me guys, what's the correct answer for this question? It's a new question. Which of the following is most common complication following first major vessel ligation during APR? Abdominoperineal resection in carcinoma rectum. So let me tell you, whenever we perform abdominoperineal resection in carcinoma rectum, there can be injury to parasympathetic supply and there can be injury to sympathetic. Parasympathetic and sympathetic supply. Clear? Or sympathetic nerve plexus. If there is injury to parasympathetic plexus, in that case what happens? The patients are going to develop bladder dysfunction. Bladder dysfunction. And you know, erection is because of parasympathetic system, ejaculation is because of sympathetic system. So here there is erectile dysfunction, means the patient will be having impotence. Impotence, injury to parasympathetic plexus. And if there is injury to sympathetic nerve plexus, here what happens? There is retrograde ejaculation. Why? See here. There is internal urinary sphincter, and this internal urinary sphincter, it is under the control of L1 sympathetic ganglia. So at the time of ejaculation, this sphincter is closed. So whenever there is injury to sympathetic system, what happens? At the time of ejaculation, semen enters into bladder also, and this is known as retrograde ejaculation. So because of sympathetic system, there is retrograde ejaculation and loss of perineal sensation. Clear? So there is retrograde ejaculation and loss of perineal sensation. Perineal sensation. So now let me see how many of you replied correctly. Yes, majority of you are marking option number B and D. Bladder dysfunction and impotence, it is because of parasympathetic. Option A is wrong. Bladder dysfunction, it is because of parasympathetic, but retrograde ejaculation, it is because of sympathetic. Sympathetic, loss of perineal sensation and impotence, so C is correct. Bladder dysfunction, it is because of parasympathetic. So correct answer for this question is option number C. Next question. What is the good prognostic factor for breast cancer reported as BIRATS 5? Tell me what is the correct answer. I am waiting for your reply. Rohan, Vijendra Singh, Mujahid Mullah, tell me what is the correct answer for this question. Good prognostic factor. Very good, Mujahid. Waiting for your reply. Rohan, Veera, Vignesh, tell me. Okay, Kishore Kumar, Nagesh, Vijendra Singh, all of you want to mark what? Option number D. All of you know that ER-PR positivity, it's a good prognostic factor. This is good prognostic factor. Very good. Sol, FP, Ataur Rahman, it is good prognostic factor. But if you see P53, BRCA1 mutation, high Ki67, all these are poor prognostic factor. Poor prognostic factor. So what is the correct answer for this question? Correct answer is option number D. Okay. Next question. See this. A 56 years old chronic smoker presented with complaints of cough for more than 1 year and weight loss. Chronic smoker, cough, weight loss. Biopsy reports revealed atypical cells. Most common cancer involved in hypercalcemia. So chronic smoker, cough, weight loss means most probably this patient is having what? Carcinoma lung. You tell me which type is associated with hypercalcemia. Associated with smoking and most commonly associated with hypercalcemia. Let me see. Nagesh Bodevar, very good. Vijendra Singh, Mujahid, Sagar, okay. Nagesh, very good Nagesh, you are correct. Sagar. Ataur Rahman, you are also correct Ataur, very good. Preeti, correct, you are correct Preeti. See, both squamous cell carcinoma and small cell carcinoma, both of these are associated with smoking, but most commonly associated with hypercalcemia. Which one is associated with hypercalcemia? This one is squamous cell carcinoma. So correct answer is option A, squamous cell carcinoma. Clear guys? It is squamous cell carcinoma. Okay, next question. You tell me. When I was taking last session on Unacademy, I told you that the question which will be asked, this question will be asked. If you remember my last session, hardly it was of half an hour, and I told you that Q SOFA, Bishop, these are very, very important SIRS mods. So Q SOFA, what is the full form? Quick Sequential Organ Failure Assessment. And how to remember? It is QRSMS. Now first let me see how many of you are going to mark the correct answer. Yes, how many of you? Majority of you are marking pulse rate, systolic blood pressure, temperature. Very bad. Let me see who marked the correct answer. Preeti, Nagesh Bodevar, Muhammad Sehzad. Very good Preeti. Nagesh, correct. Correct. So see, it is QRSMS. Q means Q SOFA. R means respiratory rate. How much? More than equal to 22 per minute. Systolic blood pressure. How much? Less than equal to 100 mmHg. And MS means mental status alteration. When somebody's mental status alteration is seen, his GCS will be less than 15. Normal GCS is 15, so GCS is less than 15. Clear? So what are the components? Respiratory rate, systolic blood pressure and GCS. No, Nagesh, it is not GB road. No, here it's different. Clear? So here GCS, systolic blood pressure, respiratory rate. Clear? So what is the correct answer? It is systolic blood pressure, respiratory rate, GCS. Very good. Don't go to that road. Okay? C. Now tell me, what is the correct answer here? Guys, tell me. I am waiting for your reply. 30 years old man presented with midline swelling, moving up on protrusion of tongue. Image is given below. What is the diagnosis? Let me see how many of you are marking correct answer. Nagesh, Mujahid, Virender Singh, Sagar, all of you are correct. Preeti, very good. Ataur Rahman, All of you are correct. So correct answer is, this is the midline swelling which moves up on protrusion of tongue. It is thyroglossal cyst. This is thyroglossal cyst. What is the location of ranula? Ranula, it is in relation to sublingual gland. Mucus extravagation cyst. Branchial cyst, it is in relation to sternocleidomastoid. Clear? So correct answer is thyroglossal cyst. Can anybody tell me what is the treatment of choice? Richa girl, Girisha, you are correct. What is the treatment of choice, guys? Tell me. For thyroglossal cyst. Treatment of choice. And you have to tell me the most common location also. Cyst trunk operation. Vijendra Singh, you are correct. It is cyst trunk operation. Clear? And what is the most common site? Most common site of thyroglossal cyst. Tell me, guys. Waiting for your reply. Most common site. Subhyoid. Vijendra Singh, you are correct again. It is subhyoid. This is subhyoid. So correct answer is option A. This question, yes, similar questions were asked in AIMS previously. There was slight modification here. See the modification. 45 years old male operated for inguinal hernia. Which surgery was done? Laparoscopic inguinal hernia repair was done. During surgery, nerve was stuck in the fixator. Whenever we are fixing the mesh, nerve was stuck. Post-operatively, he complains of loss of sensation in the right lower limb because of nerve entrapment in the mesh. There is nerve entrapment. So which nerve involvement leads to this complication? Tell me. Let me see who is going to reply for this question. Vijendra Singh, Yasra, Mohammad Sahjad. All of you are correct. All of you are correct. See, nerve entrapment is a new question. The topic is new, but the question was asked previously also. Nerve entrapment can occur during hernia surgery. If you are performing open hernia repair, or if it's open hernia surgery, what are the nerves involved? Most commonly, there is involvement of ilioinguinal. Ilioinguinal followed by iliohypogastric. So in open hernia, it is ilioinguinal followed by iliohypogastric. And in laparoscopic repair, there is involvement of genitofemoral nerve and lateral cutaneous nerve of thigh. It is genitofemoral nerve and lateral cutaneous nerve of thigh. And what is the most commonly injured nerve during laparoscopic hernia repair? Lateral cutaneous nerve of thigh. Clear? So majority of you were correct. Correct answer is D. It is the lateral cutaneous nerve of thigh. Clear? Very good, guys. Next question. Let me see who is going to mark the correct answer for this question. And this question is very, very easy. Either you can mark the question correctly on the basis of this X-ray or on the basis of just the language. 55 years old, male, chronic smoker, presented with history of ptosis, meiosis, pain in right arm and weight loss. First you tell me what is the diagnosis. Patient is having ptosis, meiosis, pain in right arm. What is the diagnosis of this? Ptosis, meiosis, pain in right arm. Diagnosis. Ptosis, meiosis. Tell me, guys, what's the diagnosis? Waiting for your reply. Sympathetic, cervical sympathetic trunk. So what is the name of this syndrome? I'm asking the syndrome. Which syndrome? No, which syndrome? Guys, which syndrome? Horner's. Sagar, first person to reply. Very good, Sagar. It is Horner syndrome. Horner syndrome. Why? Because there is involvement of cervical sympathetic trunk. Second, there is pain in the right arm. Why there is pain in the right arm? Because there is involvement of nerve of brachial plexus. So which malignancy is going to cause Horner syndrome because of involvement of cervical sympathetic trunk and brachial plexus? It is located at apex. So which tumor? Pancoast tumor. So you can see the location of tumor. It is right apical mass, and this is what? Pancoast tumor. Patient is chronic smoker. There is history of weight loss. It means it is malignancy. Clear? So this is malignancy. What is the correct answer? It is because of Pancoast tumor. So correct answer for this question, option number B. B. Guys, this is also a repeat question. Tell me what is the correct answer. Here, 26 years old male operated for redness over perineal area. Post-operative day, 5 images given below. Which of the following statement is correct about this condition? First, you tell me what is the diagnosis. Similar image was there in which both of testes were exposed and scrotal skin was excised. What is this diagnosis? Guys, tell me what is the diagnosis? Waiting for your reply. Nagesh, whatever first person to reply. Ataur Rahman, Mohammad Sehjad, Telikoti Chandu, Vijendra Singh, Vishwa Hirapa, all of you are correct. This is a case of Fournier's gangrene. It's a case of Fournier's gangrene. Okay, if you remember, in our image thon we discussed this question, same question we discussed, same. Okay, if you remember, and it is there on the app. Fournier's gangrene, you know, this is polymicrobial. It is caused by both aerobes and anaerobes, aerobes as well as anaerobes. Okay, it is a type of necrotizing fasciitis, means the structures are involved till deep fascia, skin, superficial fascia, deep fascia. These are structures which are involved. So here, testes, cord structures, urethra, carpora cavernosa, carpora spongiosa, these are spared. I am repeating, testes, cord structures, urethra, carpora cavernosa, carpora spongiosa, these are spared. So no need to excise these structures, no need to touch these structures. Clear? Now see the options. It is caused by, all of you are correct, most of you are marking option number A, caused by mixed aerobic and anaerobic infection. It's correct. Bladder diversion is required. Bladder diversion is not required. Foley's catheterization is sufficient. Bilateral orchidectomy, not done. Anti-gas gangrene serum should always be considered. No, we don't give anti-gas gangrene serum. So correct answer is option A. And this question was asked in NEET PG 2021. So it's an exact repeat of NEET PG 2021 question. Exact repeat. Next question. Tell me guys, what is the correct answer? Patient of chronic pancreatitis presented to casualty. On further examination, calculi was found in pancreatic duct. Main pancreatic duct was dilated, diameter 10 mm. Treatment of choice. Tell me. Nagesh, very good. Simhu, very good. Mujahid, Mola, Preeti, very good. Avijit, Majumdar, Vijendra Singh, very good. Medico, very good. Yara Wasif. So all of you are marking the correct answer. What is this? It's a case of chronic pancreatitis. All of you know that in patients of chronic pancreatitis, the pancreatic duct is dilated. Clear? So here, the pancreatic duct diameter was 10 mm. It is dilated. So what is the preferred treatment? We can go for pancreaticojejunostomy. And what kind of? Longitudinal. This is known as LPJ, longitudinal pancreaticojejunostomy, also known as Pusto procedure. Longitudinal pancreaticojejunostomy, also known as Pusto procedure. So what is the correct answer here? Correct answer is longitudinal pancreaticojejunostomy, option number D. Clear guys? Next, this question was asked for the first time, but it's an easy question. Okay, let me see who is going to mark the correct answer. 55 years old male presented to OPD with mass around the glans penis. You can see here, there is mass around glans penis. No lymph node enlargement. Treatment of choice for verrucous carcinoma. Can you tell me what is the other name of this tumor? Verrucous carcinoma involving glans penis. Guys, can you tell me what is the other name of this tumor? Waiting for your reply. It's a big name. Medico, Mayank. Very good, Mayank. Preeti, Medico. Avijit Majumdar, Sagar, Nagesh. Bashki Lowenstein. Nagesh, very good. This is Bashki. This is Bashki Lowenstein tumor, also known as verrucous carcinoma. This is locally malignant. Means what happens here? It is going to destroy surrounding tissue just by compression, not by invasion. That's why there is no lymph node involvement. It is locally malignant. So what is sufficient? Local excision is sufficient. And if local excision is sufficient, you just go for what? Partial penectomy. Remove this part of glans penis. So what we are going for? Local excision or partial penectomy. So best treatment, option number D. We go for partial penectomy. Majority of you were correct. This is Bashki Lowenstein tumor. We go for partial penectomy. Next question. Almost similar question was asked in NEET PG. At that point of time, C2 was asked, and this time, see what is asked? Classify CEAP category for varicose vein with eczema. Let me tell you. What is the full form of CEAP? C means clinical signs. E means etiological classification. A means anatomical distribution. Anatomical distribution. P means pathophysiological dysfunction. This is pathophysiological dysfunction. Okay, guys? Now, this C is having grading from C0 to C6. Okay? Now, what is C0? First C. C0, no clinical signs. If there are no clinical signs, it is C0. What is C1? If there is reticular veins, patient is having only minor veins, reticular veins. Now what you have to remember, C2, this was asked in NEET PG previously. This is varicose vein. In C3, there is edema. In C4A, there is eczema. In C4B, there is lipodermatosclerosis. In C5, there is healed lesion or healed wound. And C6, this is open wound or open ulcer. Clear? So if there is eczema, obviously what is the correct answer here? C. So let me see how many of you marked the correct answer. Pooja, Medico, Avijit Majumdar, Sagar, Vartika Goyal, Vijendra Singh. All of you marked the correct answer. All of you. Very good, guys. Very good. Next question. See this. A 43 years old male alcoholic came with complaints of loose motion 1 week ago. Now pain in right hypochondrium and minimal hepatic abscess of 75 cc. Tell me what is the diagnosis. This is pyogenic liver abscess or amoebic liver abscess? Tell me, guys. No. First tell me, it is pyogenic liver abscess or amoebic liver abscess? Waiting for your reply, guys. Waiting for your reply. It is pyogenic or amoebic? Tell me first. Ataur Rahman wants to say pyogenic. Pyogenic means collection of pus. And if there is pyogenic liver abscess, most common symptom is fever. There is fever with chills and rigor. Here you can see there is no fever. It means abdominal pain is there. It means it is not pyogenic. Second clue, patient was having history of diarrhea or loose motion. In pyogenic or amoebic, in which liver abscess there is history of diarrhea? Amoebic, caused by entamoeba histolytica, that's why there is diarrhea. Got it? So it's a case of amoebic liver abscess. It is a case of amoebic liver abscess. Okay. Now, what is the treatment of amoebic liver abscess? Where even you people, when you have diarrhea, what you take? You take Oflox or nidazole, you take metronidazole. So, what is the treatment here? Minimal abscess, amoebic liver abscess, what? Only we have to give high dose oral metronidazole. We have to give high dose oral metronidazole. Oral metronidazole. Clear, guys? So, what is the correct answer? Medical management. Correct answer is medical management. Now tell me, what is the dose of metronidazole in this case? Waiting for your reply. Tell me, guys, what is the dose here? Waiting for your reply. Apteka Medicine, Mayank Nalawa, Vartika Goyal, Pooja. No, not 75 milligram. 750 mg TDS for 10 to 14 days. Okay, guys. So this is 750 mg TDS for 10 to 14 days. Clear? Next question. Tell me, what is the correct answer here? It's a new question. The language is new. The concept is very old. A cleaner after ingesting a chemical containing sodium hydroxide presents with absolute dysphagia, means nothing is going in esophagus. Discomfort is there even to swallowing the saliva. What is the next step in management? First, sodium hydroxide, it's an alkali. You guys tell me, acids are more dangerous or alkali is more dangerous? Which is more dangerous, acids or alkali? Simhu, tell me. Acids are more dangerous or alkali? Alkali. Sagar, you are correct. Alkali. Why? Because alkali is going to cause liquefactive necrosis. Acids are causing coagulative necrosis. So it is going to cause liquefactive necrosis. Okay. So what is the problem? If there is liquefactive necrosis, the esophagus is very friable. If you trying to perform endoscopy, if you try to perform stenting, there will be perforation. So esophagus should not be touched. You just forget esophagus. What you do, you perform feeding jejunostomy. So in these patients, what we do, we perform feeding jejunostomy. So correct answer for this question, it is C. Okay. So majority of you were correct. Ataur Rahman, you were correct. Simhu, first person to reply, you were correct. Very good. So this is feeding jejunostomy. Tell me, guys, what is the correct answer here? Read the question. 23 years old medical student presented with exophthalmos, tachycardia, palpitations, sweating, heat intolerance. You can see eye signs. Tell me, what is the diagnosis? Tell me, guys, what is the diagnosis here? Vartika, you are correct. Vijendra, Mojahid Molla, you are correct. Prince, Vimlesh, you are correct. Vartika, you are correct. Vartika, it is Graves. It's a case of Graves disease. And you know, in Graves disease, what's the name of autoantibody? LATS. Long-acting thyroid stimulator. This is stimulating antibody against which receptor? All of you know, TSH receptor. So there is stimulatory antibody against which receptor? TSH receptor, and that's why what is the correct answer? Correct answer is C. This is antibody against TSH receptor. Okay, majority of you were correct. Very good. Next, when I was taking the last session, I told you that obviously you are going to get a question on EDH, SDH or subarachnoid hemorrhage. Every year there is one question on EDH, SDH, subarachnoid hemorrhage in each and every paper. So see the question. Patient presented to emergency with altered sensorium. History of fall 1 week back. NCCT image given below. What is the diagnosis? Yes, Vartika, Vijendra, Blue Star, Prince Vimlesh. Okay, Preeti wants to say that sir इतनी अच्छी image नहीं थी. Okay, ठीक है. Very good. So all of you are correct. You can see here there is biconvex hyperdense lesion. Biconvex hyperdense lesion. This is EDH, and you know that there is concavo-convex hyperdense lesion in SDH. So which interval is positive in EDH? All of you know there is positive lucid interval. Lucid interval is positive. You know that EDH here it is because of injury of middle meningeal artery. SDH it is because of injury of cortical veins. SDH it is because of injury of cortical veins. नागेश बोल रहे हैं कि सर बाई कॉन्वेक्स नहीं था शेप. नहीं था बाई कॉन्वेक्स. नागेश, सो टेल मी व्हाट वाज द शेप. कॉनकेवो कॉन्वेक्स. सी एवरीथिंग डिपेंड्स ऑन द इमेज. अगर इमेज कैसा है, इफ द इमेज इज हैविंग कॉनकेवो कॉन्वेक्स, लेट मी ड्रॉ हाउ कॉनकेवो कॉन्वेक्स looks like. If this kind of image is there, can you see here? Concavo convex. Clear? So this is what? SDH. Suppose image is not given. Yes, if image is not given and the age is mentioned, let me see. Let me tell you. If the age of patient is 60 years, right? And there is history of fall 1 week back. Where? History of fall in bathroom. I am telling you the typical history. Old patient, history of fall in the bathroom. Typically there is altered sensorium, patient is having SDH. Headache is there. And in EDH any kind of trivial trauma. History of injury by football, or somebody just kicked the person, or there was some injury, even trivial trauma that can cause EDH. Okay, alcoholic patient in the history. Okay, I will add this. There was alcoholic patient. Alcoholic patient. So if you see the history, just forget the image. Let's discuss the history first. If alcoholic patient is there, there is history of fall. Anybody can tell me about clinical presentation? Age was 45. Okay, 45 years old patient. 45 years patient. Okay, there was blackish inside, white hematoma. Very good. So this was white hematoma and there was blackish discoloration. Okay. Now see the question again. Alcoholic patient, age 45 years. There was altered sensorium, history of fall 1 week back. Clear? So if history of fall is there 1 week back, obviously the lesion is not hyperdense completely. There will be black areas also. Clear? So if there is black areas and this kind of picture is there, if you see the history only, it is a classic case of SDH. Right? So on the basis of history, it's a case of SDH. And if the image was given and it was not very clear, there was area which was having blackish discoloration or blackish appearance with some areas which are white, and it was looking like concavo convex, that classical is SDH. So here the diagnosis will be SDH. Guys, it will be SDH. Okay. History was suggestive of SDH, so you should mark SDH if picture was not very clear. And obviously for 48 hours only this kind of good picture is there, hyperdense lesion. After 48 hours what happens? This kind of hyperdense lesion is not seen. Clear? So it is SDH, not the EDH. I will modify this question. Next, a patient is having swelling of mixed consistency over parotid region. Here there is swelling of mixed consistency. Which of the following nerve it is most commonly affected? I think the language is not proper here. Anybody wants to improve the language of this question? Tell me, guys. Simhu, you are correct. Okay, Rafiqul Rahman. Anybody wants to improve the language of this question? Below ear lobule. Patient is having swelling of mixed consistency over parotid region, just below ear lobule, just below ear lobule, and it was painful. It was painful. One of the option was investing layer of deep fascia. Investing layer of deep fascia. Investing layer of deep fascia. Okay. Referred pain carried by which nerve? Okay, there was pain below ear lobule. There was pain below ear lobule. And referred pain was carried by which nerve? Referred pain was carried by which nerve? What were the options? Options? I think referred pain was not there. There was just pain. Yes? Referred pain was not there. There was just pain. Right? So obviously if you see this location of swelling, here there is a nerve which is having 5 branches. What is this nerve? It's the facial nerve. So the nerve which is affected or involved, that is facial. It's the facial nerve. Okay guys? Facial nerve. Sometimes what happens, there is involvement of nerve by the tumor. So that's why there is pain. It's because of facial nerve. Okay? I will update guys this question. Now you tell me what was exact language of this question. In a patient of cirrhosis with portal hypertension for variceal bleeding, what is the site of portosystemic anastomosis? Tell me guys. Okay Pratik, which nerve carries the pain? Which nerve carries the pain? Carries the pain? No? Now tell me this question. Variceal, which vessels become prominent? Okay. In a patient of cirrhosis with portal hypertension, which vessels of portosystemic anastomosis becomes prominent? Guys, please tell me what were the options. Prominent. Gastric and esophageal vein. Gastric vein and esophageal vein. What were the other options? Simhu wants to say that, okay, left colic and middle colic. Left colic and middle colic vein. Simhu wants to say that, she wants to say that, which vessel becomes prominent? Left colic and middle colic anastomosis. Vartika Goyal. So which vessels of portosystemic anastomosis become prominent? Ayush, what were the other 3 options, other 2 options? You remember other 2 options? Pratik wants to say that which anastomosis is established? Which portosystemic anastomosis is established? Okay. Anastomosis is established. Anybody remembers the other options? which portosystemic anastomosis is established? Obviously, there is portosystemic anastomosis between azygous vein and left gastric vein. Azygous vein drains esophagus, left gastric it is going to drain stomach. Clear? So, correct answer is between esophageal vein and gastric vein. Correct answer is option A. Next question, guys, tell me. Let me see who is going to mark this question correctly. Child was brought to the hospital with jaundice and passage of pale stool. On evaluation, ALP was 204. ALP was raised. Bilirubin was raised 2.46. Ductal dilatation with duct proliferation on liver biopsy. What is the diagnosis? Child, jaundice, raised ALP, raised bilirubin, obstructive jaundice with ductal proliferation. Ductal proliferation. Tell me, guys, what is the correct answer? Simu, Simu? No, no, it is not C. Fibrosis bhi tha. Yes, there was ductal proliferation and fibrosis on liver biopsy. Divya Pondurik. Very good, Divya. Very good, Divya. Maiden ki head. Simu, you are correct, Simu. HP Chaudhary. John Wick. Intermittent jaundice is there with intermittent jaundice. Intermittent jaundice. Okay. This is a classical case of extrahepatic biliary atresia. There is raised ALP, these patients have jaundice, and on biopsy there is duct proliferation and fibrosis. So this is the classical case of extrahepatic biliary atresia. Very good, guys. Now see this question. Deep ring, it's the opening in which of the following structure? Easiest question. Tell me, Divya, Ayush, Pooja, Prakash, Mania, Richa Giri. Deep ring, it is the defect in which layer or opening in which layer? Divya, very good, Divya. One option was conjoined tendon. Okay. So the option was conjoined tendon. Conjoined tendon. What is the correct answer here, guys? Very good. Everybody, majority of you are correct. It is fascia transversalis. You know that superficial ring, it is the defect in external oblique aponeurosis. Superficial ring, and the deep ring, it is an opening or defect in transversus abdominis. Clear? It is not conjoined tendon. Not conjoined tendon. Oh, sorry. I think the correct answer is obviously fascia transversalis. Correct answer is D. At the place of transversus abdominis, let's mention conjoined tendon. Conjoined tendon. Okay. So this is fascia transversalis. Deep ring. Okay. Correct answer is D. Okay. There was one question related to hernia. Anybody remembers that question related to hernia? What was that question? Image based question. Conjoint was different. Okay, transversus abdominis was there. That was a different question. Anybody remembers that? There was one question related to hernia. Okay, this was image based question. This was an image based question. And deep ring was marked. Image based question, deep ring was marked. Deep ring was marked. What was the question? Direct hernia is due to lack of which ligament? Lack of there was hernia medial to epigastric vessels. Okay, there was hernia medial to inferior epigastric vessels. So hernia medial to Inferior epigastric vessels. Obviously, it is direct inguinal hernia. Direct inguinal hernia. Okay. Direct hernia happens due to weakness of. 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 Due to weakness of. This direct hernia question was also image based. Conjoint tendon, lacunar ligament, guys, iliopectineal ligament, Okay, this was not image based question, it was direct question. So direct hernia happens due to weakness of. What is the problem in direct hernia? Actually, rectus abdominis. Okay, fourth option, rectus abdominis. So one of the boundaries is rectus abdominis. Medially, laterally there is inferior epigastric vessels and inferiorly there is inguinal ligament. Okay. Right. Abhishek Kumar wants to say that reflected part of external extensor aponeurosis. Okay, so we will recall this question and then I'll tell you the answer. Clear? Direct hernia. Now see this question, easy question. A 55 years old chronic alcoholic male presented to hospital with weight loss. Alpha fetoprotein was raised, AST, ALT normal, most probable diagnosis. Tell me guys. Simu, you are correct. You are correct, Simu. Divya, Atar Rahman, no Atar, Ataur Rahman, Maiden Ki Head, Richa Giri. Yes, majority of you are correct. This is hepatocellular carcinoma. How? Old age, chronic alcoholic, raised alpha fetoprotein. Normal AST, ALT, that's why there is no alcoholic hepatitis. Clear? Why not cholangiocarcinoma? There is a marker for cholangiocarcinoma, CA99. Marker for HCC, that is alpha fetoprotein. Clear guys? So what is the correct answer here? The correct answer here, it is B, hepatocellular carcinoma. Clear? This question is a repeat question. We discussed this question in image thon. Okay? Same question was asked. It's a repeat question. So a 30 years old female presented to hospital with abdominal pain, weight loss, sterile pyuria. Radiograph is given below. Most probable diagnosis. Tell me guys. Divya Ponduri, Simu. Most of the time Simu is going to mark the correct answer. She is the first person to reply. Richa Giri, very good Richa. Ataur Rahman, HP Chaudhary, all of you are correct. Since the patient is having sterile pyuria, highly suggestive of genitourinary tuberculosis. And here you can see there is calcified kidney. Kidney is filled with cheesy material, that is known as putty kidney. Later when it is calcified, this is known as cement kidney. So this is a classical case of putty kidney. Why not pyelonephritis? Because in pyelonephritis, patient is having high grade fever also. In nephrocalcinosis, there is no weight loss, no sterile pyuria. Staghorn calculi, there is no weight loss or sterile pyuria. Okay, Simu, I'm very sorry. He is correct most of the times. Okay, Simu, very good. Now see, this question, there was one image. If anybody is having the image, please send that image in the chat box. In a diabetic patient, there was ulcer on foot with callosities. What happens in diabetic patient, there is neuropathy. And because of neuropathy, there is neuropathic ulcers. These ulcers are also known as trophic ulcer. In which case there is venous ulcer. Venous ulcer is generally seen in the patients of varicose vein. Arterial ulcer, if the patient is having atherosclerosis, if there is occlusion at the ischemic areas, there is arterial ulcer. And malignant ulcer, it is mainly because of squamous cell carcinoma. Okay. So what? On the basis of features, it's highly suggestive of trophic ulcer. So it is also known as neuropathic ulcer. Generally, these are deep ulcers with margins. Okay, Pratik. Thank you, Pratik. There are deep ulcers. These are deep ulcers with margins. Clear? So, deep hole given in the image. Okay. So, it was on the plantar aspect of foot. Suppose this is the foot. It was on this plantar aspect. It was like this. There was one big hole on sole. Okay. So, I have that image. It's an old question. Actually, this plantar aspect, it's an old question. I'm having that image. Yes. And this was given in the book NEET Essence, if you have seen that. Okay. So, this is trophic ulcer. Now, guys, tell me, gangrenous abdominal wall with dyspnea, which of the following is incorrect? There was one image also with this question. Along with this question, there was one image also. Guys, tell me. There was one image also with this question. Yes? Okay. So, it was a case of Meleney's gangrene. Again, this question is an repeat question. It was asked previously. It's a case of Meleney's gangrene. Clear? It's a case of Meleney's gangrene. So, which of the following is incorrect? Yes, it's a case of Meleney's gangrene. Extensive surgical debridement. Generally, we have to perform the debridement of necrosed area every 24 hourly. It is polymicrobial. It is caused by streptococcus. So, multiple bacteria are responsible, sometimes staphylococcus and streptococcus. Hyperbaric oxygen, it is not useful for management. This option is correct or incorrect? Tell me, guys. Hyperbaric oxygen. C option was beta hemolytic streptococcus. Okay, thank you. It was beta hemolytic streptococcus. Nagesh, very good. So, hyperbaric oxygen, it helps in wound healing. So, it is used in management, it is beneficial. So, this option is incorrect. It means the correct answer is option D. Option number D, that is correct. Okay. Shantini Ganeshan. Okay, thank you. Now, see this question. I think there was a different image. I couldn't find that image. That's why I'm putting this image here. See the question. Patient presented with history of trauma 5 years back. What is the diagnosis based on the given image? A patient presented with a lesion on chest. There was history of chest trauma. There was history of chest trauma 5 years back. Okay, Pratik, you can okay. If you can share the link in the chat box, I will, go to that particular image. If you can share the link. Or when the video is over, in the message, in comment section, you can post that in the comment section. Okay. So, what is the diagnosis based on the given image? So, here you can see what patient is having. Patient is having some excessive scar tissue which grows beyond the wound or margin. Beyond the wound. Clear? So, this is going beyond the wound or incision, and this is known as what? Keloid. In hypertrophic scar, there is presence of excessive scar tissue, but it is confined or it is located within the boundaries or within the margin of wound or within surgical incision. Okay. So, here what is the correct answer? It is keloid. And what is the most common site of keloid? It is sternum. Most common site of keloid, this is sternum. Clear? Majority of you are correct. This is keloid. Now, see this question. A 5-year-old child presented with bleeding PR. There was presence of mucin in large number of glands. What is the diagnosis? Presence of mucin in large number of glands. Tell me guys, what is the diagnosis? Easy question. On the basis of this age also, you can mark the correct answer on the basis of age. First, you tell me what is the name of this polyp which is seen in children 5 years of age. It is juvenile polyp. What is this? It's a case of juvenile polyp. And you know, in juvenile polyp, what kind of polyp is there? There is hamartomatous polyp. So these patients are having hamartomatous polyp. Clear guys? So correct answer is option A, hamartomatous polyp. Glands were mentioned. Okay, serine. Serine, can you tell me what was the exact language? What was the language related to gland? So in Purgeghar's polyp and in juvenile polyps, it is hamartomatous polyp. Okay guys, it's hamartomatous. There was one question related to hydatid cyst. Anybody remembers what was that image? Image of hydatid cyst. It was ultrasound or it was CT? Okay Pratik, thank you Pratik. Pratik Karande, thank you very much. There was one image of hydatid cyst. It was ultrasound. Okay, water lily sign was there. CT. It was water lily sign. Water lily sign. And CT image was there. CT image. Okay. And what were the options? Simu, what were the options? Nagesh, okay, Nagesh, what were the options? If you remember. Vartika, tell me what were the options. Cause asked. Dr. Symbol. Echinococcus species was asked. Echinococcus. Okay. Echinococcus species. What were the other options? Etiology. Etiology, Echinococcus. Etiology, okay. What was the option related to surgical? Pair. What was the option? Aman, I think that percutaneous drainage, it was asked in the amoebic liver abscess, not here. Not here. That was a different question. Okay, surgical excision to be done. I think it was in that question of amoebic liver abscess. FNAC to be done. Okay. Okay, FNAC. You know that FNAC should not be done. Anybody remembers other options? Simu, Aman, Vartika, Nagesh, Meghna. Okay, so I will try to recall it later and I will look for the sources also. So here the correct answer is etiology. It is Echinococcus. Now guys, this question, alcoholic patient with aspirin developed vomiting and hematemesis. After vomiting, patient developed hematemesis. Patient also had weight loss. Tell me what is the diagnosis. So what is the cause of hematemesis after vomiting? Tell me. No. Hematemesis occurred after vomiting. Okay, 100 aspirin tablets he took. Nagesh, he took 100 aspirin tablets. Bhakti Dave, no. So So if patient is only on aspirin and patient developed vomiting and hematemesis, this hematemesis, what happens whenever there is vomiting, because of persistent vomiting, patients are going to develop, there is epigastric tenderness, melena, okay, epigastric tenderness, there was epigastric tenderness, there was melena, he was on chronic aspirin therapy. Okay, there was epigastric tenderness, melena. So if there is history of melena, epigastric tenderness, and occasionally patient took alcohol, so it is because of peptic ulcer disease. Since there is melena also, what happens in Meleney syndrome, it is acute. So whenever patient is having hematemesis, there is partial tear of mucosa and submucosa, and patient have Meleney syndrome. If patient is having long history, patient is having weight loss also, clear. So all these are findings suggestive of what? Peptic ulcer disease. So this patient is having peptic ulcer disease. No tenderness or distension. Why there is no tenderness or distension on examination? Because patient is not having peritonitis. So there is no tenderness or distension. Anybody remembers the other options? What were the other options? Okay, IT worker. Mind relax. You remember other options? Soren Day. Chronic aspirin therapy for his back pain. Okay, IT worker took chronic aspirin therapy for his back pain. Esophagitis, very good. Esophagitis. Anybody remembers the fourth option? Okay, chronic aspirin therapy for his back pain. So this is a classical case of peptic ulcer because there is history of NSAIDs, NSAID induced ulcer, that's why there is weight loss also. Hematemesis, why weight loss? Because of peptic ulcer, patient is not able to tolerate food. Okay, so here correct answer is peptic ulcer disease. Right. Clear, guys? So these were the questions. Anybody remembers any other question? Any of you remember any other question related to surgery? Any other question you remember, guys, related to surgery? So how many questions till now? There are total 30 questions. Total 30 questions were there. There was one question of gas gangrene. I expect that there was 30 to 35 questions. So out of 200, 30 to 35 means 1/6 almost. Okay, so one question was there on gas gangrene. Jennifer, can you tell me what was the exact language? Diabetes mellitus. Jennifer, can you tell me what was the exact language? Spreading, very good, Sridhar. Thank you, Sridhar. One question related to spreading variant of malignant melanoma. Superficial spreading malignant melanoma. Very good. What was this question? Superficial spreading malignant melanoma. Sridhar, come bam. Superficial spreading malignant melanoma. There was one question. Anemia and fatigue. What was that question? One child picture, back color, half face. Image of child, back and half face, back and half face. Yes, one tracheostomy image was there, right? So if anybody is having that picture, please send that in the link of that picture in the image in the comment section. One tracheostomy question was there. Congenital melanocytic nevi. Okay. It was congenital. Again, it's a repeat question, I think. Congenital melanocytic nevi. Melanocytic nevus. It was hairy. Okay. It was hairy. Very good. Anybody remembers any other question related to oncology, related to intestinal obstruction, esophagus, cyst, carcinoid tumor, neuroblastoma, pheochromocytoma, pheochromocytoma, intestinal obstruction, any question related to shock, sutures, carcinoma oral cavity, leukoplakia, erythroplakia, something like that. Malarivi syndrome, Aman, it was covered. Okay, Aman. Tracheostomy image, yes, we will include that. Sayantani Chakraborty, very good. Okay, guys. So it was really interesting and amazing session with you all. You people contributed so much in the recall. Thank you very, very much. Thank you very much. There was tumor in the palate. Santini Ganeshan, tumor in the palate. What was that question, Santini Ganeshan? Can you tell me? There was a tumor in the palate. It was in hard palate. It was in hard palate. Yes, tell me guys, if there is tumor in the hard palate, what is the most common histology? Dr. Simbal, tell me. No, it's not Kaposi sarcoma. Tumor in hard palate. In hard palate, what is the histology? It is adenoid cystic carcinoma because it is arising from minor salivary gland. What was the exact question? Anybody can tell me and options? What was the exact question and options? Yes, I know that there was one question related to tracheostomy. Anybody remembers the options of this tumor in hard palate? Okay guys, so I will try to collect the exact options. Option was squamous cell carcinoma, basal cell carcinoma, Kaposi sarcoma, and adenocarcinoma. Kaposi sarcoma and adenocarcinoma. Okay, so if it is adenocarcinoma or it was adenoid cystic carcinoma, it was adenocarcinoma or adenoid cystic carcinoma. Now imagine if it is not adenoid cystic carcinoma. Okay, fourth was adenocarcinoma. So since the lining of oral cavity, it is squamous epithelium, so most probably it is squamous cell carcinoma. If adenoid cystic carcinoma is not there in the option. Okay, it was straight Kaposi sarcoma. So it depends on the history. That patient was HIV positive or patient was immunocompromised. Yes, what kind of infection was there? So I will try to recall this question, guys. Thank you very much for your active participation. Yes, really I got so many questions and many options were corrected here. Okay, so I hope your paper was very good and you are going to crack this NEET PG with flying colors. My best wishes are there with all of you. Okay, take some rest, relax, detox yourself, enjoy. Good luck guys, good luck and best of luck for the results. Best of luck.